Hi, my name is Samantha Franklin, and today I'm going to be presenting my PowerPoint presentation. My presentation is on intentional injuries with the exemplars of assault and homicide. So if you go to the first slide, I talk about assault and just give a brief definition. So assault is the act of violence by physical force. Then I proceed to discuss the different types of assault. So sexual assault is intentional touching of another person without consent or forcing that person to engage in sexual activities against their will. So I reference this to the act of rape. Aggravated assault, intent to cause serious bodily harm without regard for human life. I like to think about this one as someone's trying to run you over with their car. They don't really care. They're just trying to off you kind of thing. And then simple assault, minor bodily harm to another person. Think of this as a bar fight gone wrong, and you get punched in the face. So how does the situation evolve? This is focused on the perpetrator. So if you look at the image on the right-hand side, the cycle of assault, usually this cycle starts with a trigger, so something that makes the perpetrator angry or causes them to feel threatened. Then it goes to the escalation phase. So this is, they're really upset about the situation. They're trying to cope with what just happened. They're getting angry, kind of can't control themselves. Fight or flight kicks in, and then you go to the crisis phase. So if we can take a pause there and then look at the left side of your screen, I kind of dissected the different levels of crisis. So level 1 is some anxiety and you use one or more ego defense mechanisms. And then level 2, you begin to use alternative coping mechanisms, since the ones that you're used to using aren't really working in this situation. You're kind of too worked up and your coping mechanisms aren't effective. Level 3 crisis is your fight or flight and panic. So this is the escalation part that you saw in the image to the right. So you're really angry, you kind of can't control the situation. You're feeling a lot of panic, a lot of anxiety, and then you go to the level 4, and this is total detachment from others, disorientation, and thoughts of violence towards self or others. And when I read that, I thought of tunnel vision. So you kind of have like a mission in plan, and you're just gonna do it because you kind of can't control the situation around you anymore and how you're feeling. So then we move on to risk factors for both the perpetrator and the victim. So socioeconomic status, as well as residence, kind of go hand in hand. So people that are poor and don't have a lot of money, they typically are more prone to having acts of violence committed towards them or committing them, as well as if you live in more of like a low class or a ghetto area, they have more incidences of violence. If you have a history of aggression or drug and alcohol use. So, think about with drugs and alcohol, you kind of have this disorientation anyway, so you feel like you can't control yourself. So if something makes you angry, you're just going to act on that impulse. Occupation was definitely an interesting one that I found. One of the occupations it listed was law enforcement as being one of the more aggressive occupations. Another example I provided was exposure to violence in family. You kind of feel like that dynamic in your family is normal, and that kind of makes you more prone to acting that way in future relationships. I also did other criminal activities. So usually the people that commit crimes such as homicide and assault, it doesn't usually start out that way. So a lot of times these people create small fires, small arsony, and they also kill animals or hurt animals. So then we move to homicide. So the definition of homicide is the deliberate and unlawful killing of one person by another, aka murder. And then we move into the care plan. So assessment, general appearance and mental status, vital signs, head to toe assessment. Most of these are for both the perpetrator and the victim, because a lot of times the victim will try to fight back, and then the perpetrator will suffer some kind of injuries, and that kind of like pieces together the scenario and the situation that happened. So you definitely want to treat the two the same. You can also do specimen collection for diagnostic testing. Later on, I talk about collaboration of SANE nursing, so that kind of goes with that. I'll explain that later. And then record and classify injury. It's really good to be detailed and documented, especially when you're partnering with law enforcement for the victims, just to go over all of the injuries sustained. Diagnosis, I did fear, ineffective coping, impaired physical mobility, depending on the level of trauma, risk for impaired skin integrity, acute pain, and altered health maintenance. So some of the interventions, definitely prioritize your injuries. Remember ABC. Some of the injuries can be very mild, like we talked about simple assault, if you get hit somewhere, and then others can be really serious, life-threatening, multi-system kind of injuries. Definitely treat the pain. They're going to be in a lot of pain, not only pain, but they're also going to be overwhelmed. So if you treat the pain, hopefully they'll calm down and be able to talk to you. So the next intervention I mentioned was encourage open communication and providing a safe and quiet environment. You definitely want to get the most information you can, especially out of the victims, about the situation and what happened, just to help with your treatment and your collaboration with law enforcement. Definitely maintain personal safety, monitor signs of aggression, and remove devices that could be used for self-harm or other directed harm. So those actually, you kind of think about, oh, okay, this guy just committed a crime, like we don't trust him, he's going to hurt us, he's going to hurt himself. But it also goes with the victim. They're dealing with a lot of emotions after this event. So they are, they're not really focused. They have a lot going on. They're in pain, they're scared, definitely traumatized. So you want to protect yourself as the nurse and also protect them from hurting themselves. And then provide positive reinforcement for appropriate behaviors. You definitely want to give them a sense of control about the situation, and hopefully this will help start their recovery, especially for the victims. Evaluation: client remains free of self-harm and other directed violence. Client uses healthy coping mechanisms. Client freely discusses concerns and feelings. Client participates in their own care. Once again, self-control and starting that open discussion and recovery phase. And then client will express that they have better control over impulses and behaviors. So then we move on to collaboration. So I mentioned SANE nursing. So SANE nurses work with law enforcement, and this is specifically for sexual assault victims. And they have a whole examination that they have to go through where they take pictures of the physical injuries. They can swab different injuries and collect DNA or semen specimens. And this kind of, proves who the perpetrator was. It also helps with STI diagnosis and monitors and sees if pregnancy can occur. You also want to collaborate with the victim's counselor and psychiatry. There's definitely going to be some trauma, and you can see post-trauma syndrome, PTSD from the situation, and you definitely want to refer them for mental health counseling. You don't want them to start using poor defense coping mechanisms and substitute with drugs and alcohol or violence themselves as the victim. You also want to talk with clergy if they are spiritual or religious. You want to offer that. Maybe they need someone who's a spiritual counselor to talk to them during the situation. And then, of course, if it's a homicide case, you always want to think about organ donation, if they're able to be an organ donor, if they chose that, and if they have any organ donations or organs left that are viable. So then we move on to the study that I included. And so the purpose of this study was to explore the process of healthcare for victims of sexual assault, and this actually took place in Iran. So there was 23 healthcare providers and 10 sexual assault victims, so I gave the age. I included that. And then the evaluation and comparison included interview questions and nonverbal cues. And really, it was trying to explain the experience the assault victims had with healthcare workers, and then how the healthcare workers handled the sexual assault victims. So for the providers, they really focused a lot on the history and physical. And in the study, it mentioned that specifically in this culture and this country, that a lot of times they would not say that they were a victim of assault just because in their culture it is not accepted to have sex before marriage. And then they went on with legal formalities, talking to law enforcement, diagnostic services, so STIs, and prevention and treatment of complications. Specifically, they talked about STIs, and then consult and referral requests. And the victims, they suffered a lot of body image issues. So throughout the study, they really talked about the hymen, and how in their culture they can't get married if they don't have an appropriate hymen, if it doesn't look good. So they had conflict between expectations of victims and healthcare services. So really the major problems was that the victims, they either wanted an abortion because they ended up pregnant from the assault, and their culture does not allow for abortions related to or as a result of rape, and they wanted hymenplasty, and that's to fix the hymen to make it look more appealing so that way they could still get married, and they really didn't have to talk about the sexual assault, but healthcare providers, it's against their culture to do that as well. So the results of the study, cultural laws can attribute to poor outcomes from sexual assault victims. So actually, because the healthcare providers would not provide the hymenoplasty or the abortions, the sexual assault victims would pay unlicensed providers to perform the surgery, or they would give themselves abortions. And lack of information can lead to misdiagnosis and mistreatment. So the victims, they would get treatment for their injuries, but they wouldn't say that it resulted from a sexual assault. So a lot of times STIs went misdiagnosed, same with pregnancies, and local law enforcement wasn't contacted because they didn't know that it was a sexual assault. So then we move on to Healthy People 2020. So what are we doing here in America? So prevention of violence, you want to improve the health of the entire community and society. So I listed all the objectives. It was 16 objectives to help reduce violence. The one I want to focus on is reduce non-fatal child maltreatment. So this kind of shows, okay, here's the objective. So how are we accomplishing this? So they actually have a home visitation program for high-risk mothers. So we listed all the risk factors. So, mothers that kind of fall into that risk. And they have home visits from prenatal up until 1 year of the baby's life to hopefully, make the mothers feel capable and prepared to take care of the children. And hopefully the children will not sustain any acts of violence because the mother is, unprepared. And then the last thing I included was a short video on YouTube, and it is a group of sexual assault survivors, both men and women, and they kind of talk about their experiences. One of the big things that I took out of it was that they all talked about communication and how talking about their situation and what happened to them actually gave them a sense of control and started the healing process. So that is why I included open communication and a safe environment in our interventions when dealing with assault victims, not only sexual assault, but this is just a video talking about them. That hopefully, having that rapport with them and, the victim's able to talk to you, they'll get a sense of control and that this doesn't determine their future, that they can recover and there's resources out for them. And hopefully we just provide that stepping stone once the assault happens. And then from there, they can just continue to recover and hopefully never have to experience this again. Thank you.